My name is Dushanka Delovska-Trikova. I'm the Chief Information Officer at Ingleside. Ingleside is a system of 3 life plan communities in the DC metropolitan area. We also have the foundation, Westminster Ingleside Foundation. We have development business and at-home business, Ingleside at Home. Ingleside started using CRISP back in 2013 when Ingleside at King Farm participated in a grant sponsored by the Maryland State, where the goal of the grant was to support transition of care of residents going back and forth to hospitals and the campus. Before CRISP, we were given access to portals of different hospitals. Using CRISP means that each user has their own username and password, which gives them access to all hospitals that are participating in CRISP, which is very convenient for us when we try to track residents when they move from one hospital to another hospital.
In the Wellness Clinic Center, we had a resident that we've encountered that was sent to the hospital for a surgical procedure, and after a couple of days she went back to her independent living apartment, and through CRISP I was able to get the clinical information, significant data that happened to her in the hospital and the needs for her post-hospitalization. And so as soon as she was back from the hospitalization, I gave her a call and offered her the wellness clinic services that we can provide to her. She was so happy knowing that we can provide that clinical services for her in the wellness clinic, that she will no longer need to be out from her community in order to receive clinical services such as the wound dressing on a daily basis at the comfort of her home.
We use CRISP in three different ways. One would be for care coordination, transitions of care, and for customer service. An example of customer service would be when we get the encounter notifications, we have our chaplain who then goes out to the hospitals to visit the residents. It's always nice when a resident has a guest from the community who comes in hand, with flowers in hand. That is one of the ways that we provide platinum service. We have our skilled nursing unit up on our 7th floor, and when a resident is out on skilled or in the hospital, our social worker follows up with the discharge planners as soon as we get a notification that that resident is in the hospital. And that immediately triggers the transitioning back to our skilled nursing center. We have the ability to know when that resident is registered in the ER, when they transition to an inpatient status, and we can start counting down the 3 days inpatient status days, and then be able to start working with our team to know what resources do we need to provide the type of care that that resident needs at our community. With CRISP encounter notifications, we get real-time information as to whenever a resident is registered in the ER or admitted to the hospital and subsequently discharged. That plays a very big role in our care coordination. I would say about 2 weeks ago, we were expecting one of our independent living residents to transition back to our skilled nursing. We thought this admission would be happening on a Monday. However, on a Sunday, we got an email saying that that resident has been discharged. When we got back to the office on Monday, we were able to track this resident down and find out that they did go back to their independent living apartment, and we've been working with the family ever since then to have her transition to assisted living. With the portal, we have the ability to pull diagnostic testings and results. We can also pull medication lists. That is very beneficial because it helps us be able to identify the key resources that a resident would need if they were coming back to our skilled nursing.
CRISP has been really beneficial for me overseeing independent living residents because I'm able to see if they get registered into an emergency room, and even if they get admitted. So from there I can then coordinate with our social worker, contact people in our health services departments, and prepare if a resident needs to come here from the hospital. Well, I think for me the most important part for CRISP is that the hospitals put the information as to why they were admitted, and I can then prepare for their care when they're coming home. In my role as overseeing independent living residents, I run a review committee. The reporting from Chris would be helpful to identify trends as to why residents are going into the hospitals. For example, about 40% of our residents we're finding are entering hospitals because of a fall. So this type of reports would be helpful for us to be able to provide better services, maybe to understand why they're falling, and to see if there's ways we can prevent these falls in the future.
Our residents don't necessarily move through the continuum of care. They want to age in place, and we would like to be able to provide care in their home settings. We have been very happy with using the data that we can share in CRISP.